Today I want to talk about the Joint Commission. And to get this out of the way, in case anybody asks, because somebody asked last year, this has nothing to do with medical marijuana. The Joint Commission has nothing to do with medical marijuana. Somebody asked that last year in class. So, seriously, the Joint Commission is the agency that certifies the hospital. The Joint Commission is a United States-based nonprofit tax-exempt organization that accredits more than 21,000 healthcare organizations and programs in the United States. There's also an international branch that accredits medical services around the world. A majority of state governments recognize Joint Commission accreditation as a condition of licensure and the receipt of Medicaid and Medicare reimbursements. The Joint Commission on Accreditation of Hospitals is founded in 1951. In 1965, the federal government decided that a hospital that met Joint Commission accreditation met the Medicare Conditions of Participation. In 1987, the company was renamed the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, and some people still use the term Jayco. I did most of my healthcare training and knowledge in the 80s, and I still call the Joint Commission Jayco all the time. So if you hear me say Jayco through this, I really mean the Joint Commission. In 2007, the Joint Commission on Accreditation of Healthcare Organizations underwent a major rebranding and simplified its name to the Joint Commission. So, 1965, I want to go back to the 1965 date. The federal government decided that hospital that met Joint Commission accreditation met the Medicare Conditions of Participation. So, a good deal of funding, revenue that comes into a hospital comes from Medicare reimbursement. Most patients are older Americans. Most older Americans have Medicare as an insurance supplement. If you have a hospital and you're not getting Medicare dollars, you're not going to be open for long. One of the biggest revenue streams of a hospital is Medicare. Medicare, Medicaid, this is where a hospital gets its money from. So it's important that you meet the conditions to be a Medicare participant. Inspection. All member healthcare organizations are subject to a 3-year accreditation cycle, while laboratories are surveyed every 2 years. With respect to hospital surveys, the organization does not make its findings public. However, it does provide the organization's accreditation decision, the date that accreditation was awarded, and any standards that were cited for improvement. Organizations deemed to be in compliance with all or most of the applicable standards are awarded the decision of accreditation. So basically what all that means is you get surveyed by the Joint Commission. Their findings, positive, negative, aren't made public. They just publish to the public whether you passed or whether you didn't pass the survey. The unannounced full survey is a key component of the Joint Commission accreditation process. Unannounced means the organization does not receive an advance notice of its survey date. The Joint Commission began conducting unannounced surveys on January 1, 2006. Surveys will occur 18 to 39 months after the organization's previous unannounced survey. And here's the thing, it wasn't always like that. There's been criticism in the past from within the U.S. of the way the Joint Commission operates. The Commission's practice had been to notify hospitals in advance of the timing of inspections. A 2007 article in the Washington Post noted that about 99% of inspected hospitals are accredited, and serious problems in the delivery of care are sometimes overlooked or missed. Similar concerns had been expressed by the Boston Globe, stating the Joint Commission, whose governing board has long been dominated by representatives of the industry it inspects, has been the target of criticism about the validity of its evaluations. So think about that. Prior to 2006, Joint Commission surveys were announced. In other words, the Joint Commission will call ahead and tell you when they were coming to do their inspection. Now think about that for a minute, and you know what week they're coming. An inspection normally lasts 4 days. Does that lead to a process where everything looks good on inspection week and the rest of the year it's crap? Of course it does. And that's what led to the criticism of the process, right? If you know your mom is coming to inspect your room to see if it's clean, you're going to make sure the room is clean, or at least you stuff everything in the drawers and hide it under your bed. Mom comes in, she says your room is clean, and you go back to making your room a mess the way you always have. That's just human nature. Preparing for a survey. Preparing for a Joint Commission survey can be a challenging process for any healthcare provider. At a minimum, a hospital must be completely familiar with the current standards, examine current processes, policies, and procedures relative to those standards and prepared to improve any areas that are not currently in compliance. The hospital must be in compliance with the standards for at least 4 months prior to the initial survey. The hospital should be in compliance with applicable standards during the entire period of accreditation, which means the surveyors will look for a full 3 years of implementation for several standards-related issues. In other words, they're going to look at your logbooks and make sure your logbooks are good for 3 years, that you didn't just start keeping the logbook last month because you figured it was about time for them to show up. Joint Commission charges an average fee of $46,000 for a full hospital survey. Reimbursement for the surveyor's travel, living expenses, and accommodations is required in addition to the fee. There may be additional costs related to consultant work directed towards assisting a hospital to be successful in the accreditation process. So if you want to get accredited, it costs you $46,000 for a full survey, plus you got to pay for the travel, hotel, and meals for the 5 surveyors that are coming. It's not a cheap thing. As for the surveyors, the Joint Commission employed salaried individuals, people who generally work or have worked within healthcare services, but who may devote half or less of their time for the accrediting organization. Surveyors travel to healthcare organizations to evaluate their operational practices and facilities against established Joint Commission standards and elements of performance. So the surveyors come from people who already work in the healthcare field. They usually have a lot of experience, and they just do this kind of as a part-time job. They'll, get scheduled for a survey in April, get scheduled for a survey in August, and they'll fly out and they'll do that. So it has to be somebody that can travel, can leave the organization, can do these kind of things. Alternatives. The Joint Commission is not a complete monopoly, and while many states in the U.S. make use of their services, not all do. Some states have set up their own alternative assessment processes. The Joint Commission is not recognized for state licensure in the states of Oklahoma, Pennsylvania, and Wisconsin. So, you might think the Joint Commission is not needed for state accreditation, so it's not a big deal in Pennsylvania. Well, wrong answer. All hospitals need Medicare and Medicaid dollars, as I talked about before. Without those federal funds, most hospitals will go out of business, so even though it's not required to get a state license to operate a hospital, you still have to pass the Joint Commission survey to get Medicare and Medicaid dollars. If you really don't want to deal with the Joint Commission, your only alternative is to get DNV accreditation. I worked at a hospital that switched, and DNV was cheaper and easier to get. On September 26, 2008, the Centers for Medicare and Medicaid Services granted deeming authority for hospitals to DNV Healthcare, an operating company of Det Norsk Veritas, a Norwegian international company that's been operating in the U.S. since 1898. So if you don't want to be Joint Commission, you can be DNV. And like I said, I had a hospital switch to DNV, and it was cheaper and easier to do. So here's the Joint Commission quality report from Lancaster General Hospital. They were last surveyed in late August of 2015, so they were probably surveyed sometime around August, September 2018. I didn't see their accreditation up on the site when I checked it this morning, but I'm sure it will be there soon. So there's LGH's quality report from the Joint Commission. Thank you for watching.